Well, I tell you what, it is a disturbing trend, this new report revealing that younger adults are vaping nicotine, using marijuana, and even taking hallucinogens near a historic high level.
Joining us to talk more about these findings, OU Health's Dr. Tiffany Bartell. Doctor, thanks for joining us. We appreciate it.
Thanks for having me.
Pretty alarming when we just said that first sentence. What are you seeing, and are there reasons behind this increase?
So we are actually seeing increases in use in a lot of different substances, both in a younger population, ages 19 to 30, and the older population as they're defining it, ages 35 to even 60. I think in general, across the board, it has to do, we see increased availability of a lot of the substances, as well as increased accessibility to a lot of these substances.
Yeah, and it does so much damage. I mean, you know, if it starts with people young, I mean, it's like it can be recreational or however they get involved with it, but how are they getting a hold of this stuff?
You know, there are all different avenues now. You know, we do know there are websites from international areas where they can be purchased, social media, there's all kinds of back ways through it. And so I just think part of that is it's easier to find.
Yeah, and then the addiction levels just increase. Like, I mean, it can be addiction for drinking, drugs, and even hard drugs.
Yes,
I mean,
absolutely.
It's like the net spreads wide on this.
Yes, absolutely.
What about the continued use? Do you think some folks that get into it mean to stay in it, or do you think what's happening there?
So we know addiction does have a biological basis, and so it really does change the structure of the brain, causing them to be, you know, addicted to it without making the constant choice to be addicted to it. So we do know there's a chemical backing behind it that makes them want to use it, even though, you know, in reality they may not actually want to use it.
What about binge drinking? What are you seeing?
Binge drinking and drinking in general, we've seen an increase. We know with the pandemic that there was an uptick in basically drinking of every kind across the board. This study that we've been looking at recently, we've seen an increase in both past year use with alcohol. It's up to 85%, which is on a general trend. We've seen an incline. When we compare that to 10 years ago, it's about 83%. For daily, or for binge drinking, we've also seen a little bit of a bump. 29% of adults age 35 and older were admitting to binge drinking, which they're defining that as 5 drinks pretty much in one sitting.
Dr. Bartell, just what's your message maybe for parents who have young kids going off to college, or spouses that are involved in some type of addiction? There is help available.
Yes, there is tons of help available. Also, when people are getting hold of these substances, they may be under the impression that it is just one substance, but unfortunately we've seen a lot of these things are being put in combination. So when they think they're getting, say, a Xanax pill, it's also got fentanyl in it. So they think they're taking one thing, but they're actually getting a hold of multiple substances. So please be very vigilant when you do think you're getting a hold of something, and then letting them know it's okay to come talk about it if you think you have an issue. There's plenty of help out there. Part of my job has been creating a clinic to help with outpatient resources for that.
Dr. Bartell, thank you so much.
You're
Good
welcome.
information
You're welcome.
today.
Nice to have you.
Yes, thank you.